It's been probably the most difficult 4 months of my career, watching this happen and realizing that we're going to feel this for a long time.
This goes sort of way beyond just day-to-day expectations of what a doctor or nurse or environmental service person is we expect from them. This is much more than that. We've seen where people have died from this. We've seen where even younger people have died from this. And so this, on many levels, was really heart-wrenching.
People were afraid. Providers were afraid. This was a moment, however, where you put that fear, that devil, down in the hole.
We took our best minds, we got them all in a room, and we said, here's a problem, let's solve it.
There was an unparalleled sense of unity and pride in doing something together for Northeast Ohio.
UH prides itself on responding to the needs in our community, and true to our mission to heal, to teach, and to discover, we exemplified all three of these in the face of COVID.
We had been aware of, obviously, the existence of the novel coronavirus in early January and had been making early preparations in advance of any potential patient coming to our system.
We started to recognize this was going to become a real risk to our community. The hospital incident command system was stood up, and a physical command center was structured in the basement of one of our buildings.
We had key leaders in place that had varying levels of expertise that all came to a table that actually helped guide us to put our plans together to ensure that we were prepared not only as a system, but locally as well.
We knew it was coming. We didn't know when it was coming, but we knew we needed to be prepared, and prepared upwards of 300% surge in our existing ICU capacities and beyond. So we're talking about building field hospitals.
Operationally, we weren't surprised by anything. The team was prepared. What we were surprised by was the volume of COVID patients not being as high as we had anticipated. I think that's a direct testament to the leadership of Governor DeWine and Dr. Acton, and quite frankly, the compliance and the stewardship of the citizens of Ohio.
Fortunately, as the pandemic progressed, we did not see that surge of patients, and instead, the expression of the pandemic in Ohio has largely manifested itself in congregate living environments, skilled nursing facilities, group homes, other areas of high-density housing, and that challenged us to think differently about how to prepare and how to respond.
So right from the very beginning, we were keeping an eye on those congregate living facilities, keeping close contact with all of our medical directors in those facilities, and then watching any trends in our hospitals from emergency departments to admissions to see if we could identify any potential areas that we might be seeing an outbreak of COVID.
We had several area nursing facilities that had been engaged in an outbreak early on, actually became aware of it through our hospital partners who were starting to see patients coming into the emergency department and needing some fairly intense medical care. So we started to proactively outreach then to the local nursing homes to get an idea of what was going on and to see how we could help.
I can remember the very first skilled nursing facility that popped up, over a weekend, and by Sunday morning, they had quite a few cases, and we were trying to figure out the right thing to do. And we were really faced with the question of, do we try to transport all of those patients to one of our hospitals, or do we take our resources and take it right to the skilled nursing facility?
We responded in a fairly innovative way, establishing a task force and a strike team that would actually go out to the sites, bringing clinical expertise, equipment, testing, and that really was the beginning of a testing and treating in place strategy.
So the first building was reactive by nature. There was an issue, we heard about it, we responded to it, we helped them. But very quickly, we learned that we needed to be proactive and prepared for the next one. We knew another building would fall ill with COVID.
We had put together this playbook, which was really a pre-planning and management guide for outbreaks in specifically nursing home settings. And when we had an outbreak in a Geauga facility, one of our teammates took it upon himself to proactively engage this facility, run them through our playbook, and look for ways that he could help them to manage this particular outbreak. And from there, our Intercept team was born.
I don't think anybody could tell this story without tears. It was overwhelming. The emotions were overwhelming. Staff were exhausted. Families were quite distraught and concerned, of course, for their mom or dad that was here.
It was physically, emotionally, and mentally exhausting. We are caring for these patients. We are loving these patients. As we care for them, or as, tragically they pass away, we are there holding their hands, being with them, comforting them.
When we had 2 residents that passed overnight, and we didn't have enough staff to sit by them. I remember going into the administrator's office and asking for help, and within the next day I had university there. Simple things to hold their hand. Nobody should have to die alone like that.
We quickly responded and worked with their leadership. The Omens were fantastic and are wonderful people to work with.
Even before the pandemic hit, we were working with them to help get their new ventilator unit online. We were putting in remote monitoring capabilities in anticipation of needing their help.
We wanted to be the downstream provider from the hospital that could help properly take care of these residents. But what ended up happening was most of it developed within our facility, and university hospitals came and supported us and helped us.
We had an asymptomatic patient come in here who we weren't sure when and how and what it was all about that brought this individual in here. But that's one of the more nefarious parts of the COVID-19 is that you can have an asymptomatic carrier that is impacting and affecting many other people, but it's invisible and nobody knows that it's actually occurring. Once we identified that the individual did have COVID, we started to see symptoms amongst others. And it went from 1 to 2 to 3 to like 7, and then 7 to like 31 overnight.
And it was like a tidal wave, and without exaggeration, a tidal wave of a virus that not only hit your patients that you care for, but hit your staff.
We had a large amount of our staff out with COVID themselves. We were struggling to provide the basic needs for these residents, and I'm talking about feeding, toileting, cleaning, those things that you don't think about nursing, that nursing does.
The normal staffing agencies that we would use to fill in staffing needs were very reluctant to come in and do work here because they heard that COVID-19 was in the building. And there was a lot of nurses out there that didn't want anything to do with it. And that's where we really were in communication with university hospitals.
I distinctly remember, I believe it was a Thursday night, the conversation that I had with Jonathan Seque. I said, we need some help here. It's coming to a critical point once those patients started testing positive. And he said, we saw this happen in another building. Myself and some other acute care nurse practitioners have worked to develop a plan to help manage an outbreak that was going to happen in a building like ours. And he said, if you're willing to follow the plan and your team's willing to follow the plan and work collectively together with our teams, we are open to coming out there, I think he said, at 0900 hours on Sunday morning.
You can't help but take this a little personal when the outbreak happens to your community, a great partner. And so there's no lack of motivation to do what's right.
I just remember not knowing what to expect that Sunday morning, but after 3 hours of doing a tabletop exercise and then doing a situational analysis where where the team of acute care practitioners that had been experienced in emergency medicine had walked through our building. They gave us order, they gave us structure, they gave us a plan to begin to execute. They really helped us to be able to think right in response to what was going to be necessary in the days that were ahead of us.
Quickly, we had staff members in here. I recall a group of leadership from University Hospital coming in and walking through the facility, and me giving them a list of things that I needed just to provide the basic care for our residents. And by that evening, I had those things. And it just continued from there.
The team of nurses, the team of nursing assistants, the medics that came into the building, I mean, they came in, they jumped in with 2 feet, they helped out any way they could. It was very much a partnership mentality. We're here to help you. How can we help you? And where do you need us most?
We had a paramedic that walked in the front door after we had signed a contract with UH to be able to have some of their team come in here. And he said, I understand that you have COVID in your building. I'm here to work on the front lines. Just point me in the direction of where I need to go. And I said, up those stairs. And he was up the stairs with no hesitation. And later that day, when I walked through the COVID unit, I just saw him working shoulder to shoulder with the people that were taking care of the patients that had tested positive.
It was very nice to see that somebody cared for our residents as much as we do.
As hard as we were hit, within 3 days' time, we were already starting to gain some control of the situation. By the end of the first week, we had a strategy, we had organization, we had staffing in place, and we had really a protocol to work off of and how to defeat this.
In 72 hours, we saw them go from a point of being afraid to being in control of the situation. They had the playbook, they were following it step by step. And when I talked to Joshua, he said, there's COVID in the building and nobody would know it because we have a plan, we're executing it, I'm walking the hallways with the playbook in my hand.
It was awesome that we had all the resources that they needed in the moment when they needed it. So we were able to go over there and provide not only the nursing staff, but also infection control education. We're able to provide guidance on how they should set up their units with the COVID positive and COVID negative area, help them with their workflow, help them to get a good understanding of how we can partner with the doctors and the transfer center. So if they had patients that were sick, they didn't have to come through our ED. We could directly admit them into the hospital.
In turn, what it helped do was it helped almost make them into a remote hospital because they had the equipment and the monitoring and the resources and the expertise. And so what was done really well was they were able to adequately and safely care for patients that had COVID virus in their own facility instead of having to move them to a hospital. Now, certainly we were willing and able and capable of taking care of the patients, and some of the patients did get transferred to Geauga. But one of the things you want to do in a COVID endemic area is you want to minimize the amount of unnecessary touches and encounters, because you don't want the virus spreading from provider to provider to provider. They
truly were in command and control. That's what we were helping them gain. That's what they didn't have in their own environment. We were giving them command and control back over their situation. They made the decisions. We created the environment for them to succeed.
I could easily say this would have been a much different story if university hospitals didn't help out to the extent that they did.
They have not only a strong, very smart leadership team, but that team cares. And that team's competence and compassion was evident, that they were willing to go, how do we actually figure out the right solutions? They were committed to making the right solutions.
I believe really that when we talk about patients first, this is one of the finest examples.
It makes you really proud of the team that did all the work on the front lines every day. The immense amount of support from the hospital and command system behind us that allowed us to do that work.
It was a very difficult thing to watch as they struggled through the pandemic, but as we came through that into recovery phase, it was probably the highlight of the last 4 months of my professional career when we got the email that finally came through that said we were officially recovered, the last person is off isolation. That was very powerful to our team as a whole to know that the investment that we made had paid off that way and that there were people who were helped by the support that we could give them.
I mean, even hearing and being a part of conversations with Dr. Canone and the governor's office and the director of Medicaid and all of those others, they were saying, how do we replicate some of these things? I think that some of the lessons that we learned from a practical operation standpoint, it was cool to be able to see how we were able to share them with others, even getting on the phone with other administrators that were facing it.
Our Intercept approach has really been unique, and not only here locally, but around the state and the world, actually. There have been many who have been good at putting out protocols about how to manage patients, how to utilize personal protective equipment, how to implement governmental guidance. But there have been very few who have actually physically got involved on the ground to kind of help pull together this coalition strategy of local health systems, facilities, and then health departments to really kind of navigate these crises. And so the World Health Organization came to us about a month and a half ago looking for some help on an advisory board as they think about ways to approach congregate settings around the world. They're looking at some of what we've done with our Intercept team to really help inform what they may do should the pandemic really catch again here in the fall or winter.
When we think about the number of facilities that in some way, shape, or form we were involved with, the number is over 100. At one point in time, we were actively managing upwards of 40 buildings at one time in some capacity. And it's been really something that we're proud of. And if you think about how the UH reach has gone well beyond our traditional space, it's pretty impressive.
Our approach on this very early on was very aggressive in bringing resources to the patients, whether it was personnel, PPE, supplies, whatever was needed, as a much more efficient way of managing a COVID outbreak.
What we were able to do for all of those patients in all of those congregate living facilities, in all of our hospitals, for all of our caregivers across the system, I know we saved lives. I know we prevented suffering.
At UH, we're very lucky to have senior leadership who has vast experience, especially in disaster preparedness, EMS, mobile healthcare, mobile medicine, unplanned care response, because we needed to take everything that we have learned from those walks of life and apply it to our COVID-19 outbreak throughout Northeast Ohio.
We're really working together to find who has the information that we need to solve this problem and make sure they're at the table. And I think that's critical in complex health systems going forward.
As we've been managing COVID for months, and we're probably going to unfortunately have many months ahead of us, it really empowers us as a leadership team to say, we can do anything, working together. We don't need to let anything get in our way, break all those silos down, and let's just really take care of our community together.
We were able to stand up capacity management strategies, remote-based monitoring, COVID-specific units, kept patients who needed to be in a hospital closer to their home, minimizing transfers throughout the system. We kept our emergency departments, which were the #1 portal of entry, obviously, safe through a very deliberate PPE strategy. So these were all challenges that were met and exceeded by a team of people who, when asked, rose to the challenge.
It's been really heartwarming to see both governmental agencies, healthcare systems come together and think through a very thoughtful approach to how we can collaborate to solve a problem that, frankly, none of us could deal with on our own.
UH learned and reinforced its mission of to heal, to teach, to discover. I would add one more: to serve. We were there to serve each other and our communities.
UH has a storied history, and during this pandemic, we were able to bring the science of emergency management to life with flawless execution. The ability for our organization to embrace public safety, emergency medicine, infectious disease expertise in a way that really positioned us to lead in the community and at a state level in response to COVID-19 is something I'm particularly proud of.